So I at least give Bernie Sanders credit in the particular area that during an election, he at least will admit to the voting public that he will have to raise taxes on the middle class in order to get revenue for his program. Now, the amount that is stated on his website is 4%. That means 16% will be taken out of your check. But that would not even give you the amount you need, especially since on page 8 of his Medicare for All bill, he wants to get rid of all private insurers. Now, one of the things I like to do is to have civil discourse with my friends and other individuals who I disagree with on particular issues. These individuals will teach you the most on particular issues. And that is because if they are intelligent and articulate, they will give you reasons that support their position that you have not heard and you will not hear on any media forms, because media is just there to get you amped up. So you will keep watching and you will see the advertisements, more eyeballs for more advertisements. Going over the intricacies of healthcare policy is not going to get you emotionally invested in the particular channel. And then you have to make arguments that debunk their arguments. And then it causes you to educate yourself more on whatever particular issue you guys are debating. So this individual, she asked me, why can't we cut out the middleman? Why can't you or me, the average American citizen, directly negotiate with the doctor, healthcare provider, rather than private insurance companies? Well, then the question you have to ask yourself is, what is the purpose of insurance? Well, the purpose is to transfer the potential loss to the insurance company in exchange for a fee. Whether it's dental insurance, car insurance, whatever it is. Say you're in a bad car wreck. Well, if you are insured, then the loss is taken on by the insurance company. And then you as an individual are not bankrupted. You always hear these sob stories about, and they're sad, don't misunderstand me, but you hear these stories about people who are uninsured that have a catastrophic event and then they're taken to a hospital. And while I sympathize with those individuals, if they had some sort of insurance, then that cost will be passed on to the insurance company. So what you got to consider when speaking about healthcare coverage is that everything has a cost. And someone has to pick up that tab, whether it's the taxpayer, insurance company, etc. And so that potential loss is passed on to the company instead of the individual. I created this algorithm that I stated earlier. All three of these things, a good healthcare plan would attack. They would involve these three individual things. Incorporate, I guess, would be the correct word. So these are three things that you're always going to have, regardless of what healthcare system you have. You could have single payer, you could have public/private like we do now, because we do not have a free market system. The government is involved in the healthcare system. You could have purely private insurers, and all three of these things would be incorporated into the system. The first one is costs. The question is who will be paying the cost and how much. The second thing is demand. Healthcare, doctors, medicine will always be in demand. And the third thing is supply. How much someone gets, which could be a doctor's time, the amount of drugs, medical supplies, etc. And so you always hear under Obamacare, more people are insured. Under Bernie Sanders' plan, more people would be covered. The average ignorant individual, especially the one who's been indoctrinated, is going to think, oh, okay, that's all that matters if more people are insured. But just because you increase the amount of people covered doesn't lower the cost. It doesn't change the supply, and it increases the demand. So Obamacare, the main issue with it is that it increased the demand, but it lowered the supply. The Affordable Care Act did. And it did nothing. In fact, it did more negative things in terms of cost. And so any good healthcare plan would directly attack these particular things. So the question is, how can you attack the root cause of the rising healthcare price in America today? Well, one way to attack costs is to roll back the tax burden on insurance companies. The Affordable Care Act added a $60 billion tax on health insurers, which made them have to charge more to their consumers to have to cover their costs. Taxes roll downhill, so a tax on insurers means a higher tax for all of us. That's why these fools also say we need to raise the corporate tax. Well, businesses have to cut costs in order to be competitive on the market. So if you increase the corporate tax rate from 21 to 24%, what ends up happening is that the business has to cut costs somewhere. So the prices of the goods are more expensive to the consumer because a tax is also a tax on the consumer. So when you charge $60 billion for insurance companies, what that does is it causes the price to increase to the consumer who is paying those monthly fees. The second thing, which it takes care of the supply, is lower regulations on health plans. The Affordable Care Act has a lot of requirements that force insurance plans to cover an incredibly long list of benefits. If you want a bare bones plan that simply covers catastrophic events, like a car accident or cancer, you currently can't get one. By boosting the benefits of every plan, it restricts competition and drives up prices by forcing smaller health insurers out of the marketplace. Low-cost catastrophic plans that are normally purchased by younger, healthier people are no longer available because of the Affordable Care Act requirements. So one of the ways that you help demand and supply is introducing as many insurers as possible. And if you have more insurers in the marketplace, it will drive down prices by engaging businesses to compete to cut costs. So let me give you an example. For years and years, my family plan was under Verizon Wireless. Now, under Verizon Wireless, between 5 people, we had 5 gigs. So each of us had 1 gig. The price was $50 a month for unlimited talk and text. Well, once our contracts ran out, Cricket offered $35 a month, unlimited talk, unlimited text, and 20 gigs of data. And so instead of 5 gigs, we wanted 20 gigs. So we went to Cricket and got a cheaper phone plan. See, if the insurance companies would follow the same criteria, the consumer could have cheaper plans. If you want something minimum like me, I don't smoke very often, I don't drink very often, I exercise 5 days a week, I take care of myself. If you're like me, you want the bare bones policy that you can get. If there's more competition on the marketplace, if you didn't cause these companies to all have to have certain criteria, there would be more companies competing against one another in terms of cost. So the consumer could make the decision on what particular healthcare policy works for them. The interesting thing about the Affordable Care Act is it created less competition and higher prices. The third would attack supply. You would encourage medical innovation. The cost to bring a new drug to market already exceeds $2.5 billion. And the Affordable Care Act places an additional $22 billion on new drugs. Punishing drug producers forces them to increase prices to make up for the money lost in research and development, production, advertising, taxes, etc. So basically, when you hear somebody say, this company spent this much on advertising, well, if a new drug comes to market, it has to get the word out somehow, right? If you could have the greatest product in the world, you could be the greatest singer on the planet, but if you only sing in your basement or in your shower and no one hears you, then you are not providing anything of value to society, right? So the only way to get out your product, get out your ability, is to advertise yourself, whether that's on YouTube, whether that is on television, so on and so forth. So companies have to use advertising in order to put their name out there. But this is more of a economic approach. So if you look at everything the Democrats are doing, everything that their platform consists of in the election months, it's a power grab. They want to control more of your tax money. They want to control your education. They want to control your health care. They want to control what you eat, what fuel you put in your vehicle. That is the goal of the Democratic Party. So all of it is a power grab. Healthcare is 17.9% of the U.S. economy. So politicians want to control more and more as means of percentage of the economy. Think about it. You're letting the government control 17.9% of the economy. What happens when the government controls the supply, the demands, and the means of production? That's when you get into a communist government. And that is the goal of the New World Order. They want either corporations or governments to control more and more of the individual's life. That way the decisions are taken away from the individual, and the government then is able to ration things out. But think of the DMV. Nothing against the people that work there. But I lost my license, so I had to get a new one. When I went to get a new license, it took me, just to get a picture, because of all of the individuals waiting, it took me an hour and a half, literally an hour and a half, and I went there in the morning. I went there when the place opened. And when I got there, I literally had to wait outside just to see somebody. It's not the people's fault. They genuinely are polite and do a good job there. It's just that when you only have one provider of something, when you only have one supply of something, and you still have the same demand, then it increases wait times. So in Canada and Ontario and in all these areas where they have government health care, the waiting time increases because you have more of a demand but less of a supply. And that's what ends up happening as a result. Now, I'm open-minded. I think individuals that cannot afford it should have some type of government plan. I mean, hell, it's cheaper if they're insured already than if they were to have a catastrophic event happen and they were uninsured. But one size doesn't fit all. This is not a one-size-fit-all thing. Every individual should have the choice, especially healthy individuals like myself who pay taxes should have the choice of what particular healthcare plan they want, what requirements they need, and what insurers they want. And in Tennessee, where I currently live, The only insurers we have are Blue Cross, Blue Shield, and Humana. That's it. That's basically all the. It's kind of like what happened during the agriculture revolution when you had these grain companies that ended up supplying most of the grain to the world because these smaller companies could not keep up. Same thing with the media. What happens is these large companies buy off the smaller companies that cannot compete because of regulations, taxes, and things like that. And that's what happened to the insurance companies. We have less choice in the marketplace. Think about how much cheaper cell phones have gotten, cell phone plans. Unlimited talk, text, and data are now readily available because you have more competition. Verizon now, I saw a commercial. For $35 a month, they give you everything Cricket does. Simply because you had competition in the marketplace. And that's what we need, more supply for the increasing demand with lower cost and more competition. We need market-based solutions, not more government control that is consolidated. We don't need the government controlling 17.9% of the economy. All it is a power grab.